Welcome back to Peer-Guided DBT Lessons, provided by DBT Skills application, Peers Helping Peers. This week's lesson, marked 3-1 in our Emotion Regulation module, we'll be looking at what is emotion dysregulation. Please keep in mind that we're simply peers helping peers, working together to bring about more constructive, peaceful, and ultimately happier lives. In other words, a life worth living. What is emotion regulation? Marsha Linehan, an American psychologist and author, and the creator of dialectical behavior therapy, says that emotion regulation is the ability to control or influence which emotions you have, when you have them, and how you experience and express them. Regulating emotions can be automatic as well as consciously controlled. Emotion dysregulation is the flip side of emotion regulation. Marsha Linehan goes on to say, emotions are out of control or dysregulated when you are unable, despite your best efforts, to change which emotions you have, when you have them, or how you experience or express them. So, what does emotional dysregulation look like? Do you have a tendency to overlook your feelings? Is what you are feeling not a big concern? Do you have difficulties recognizing your emotions when you are upset? Do you not take time to consider your true feelings? Do you consider your feelings unimportant and unreasonable? Are you having difficulties making sense of how you are feeling? Do your emotions confuse you? When upset, are your emotions so overwhelming that you feel it is difficult to control your behaviors? Do you have difficulties concentrating, completing work, or thinking about other things? Do you feel guilty of your feelings? Do you become ashamed, embarrassed, or angry at yourself for the way you feel? Do you believe your feelings will persist over a long period of time? Does it take a long time to feel better? Is it difficult to think of anything that you can do to make yourself feel better? Does wallowing in your feelings seem like the only thing that you can do? If you answered yes to the majority of the questions, you may be experiencing difficulties regulating your emotions. Emotion dysregulation is a term used in the mental health community to refer to an emotional response that is poorly modulated and does not fall within the conventional range of emotive response. Emotion dysregulation may be referred to as labile mood, marked fluctuation of mood or mood swings. Emotion dysregulation may present itself in people with psychiatric disorders, such as attention deficit hyperactivity disorder, bipolar disorder, borderline personality disorder, complex post-traumatic stress disorder, and more. Because emotion dysregulation is always present in borderline personality disorder, or BPD, we will look closer at this condition. Borderline personality disorder, or BPD, is also known as emotional dysregulation disorder, or emotionally unstable personality disorder, as presented by the World Health Organization from 1992. Despite being referred to as a personality disorder, BPD is not a personality defect, but is best understood as a limitation in a person's capacity to regulate emotions. A limitation in a person's capacity to regulate emotions means that you can sometimes experience emotions as overwhelming, spiraling out of control, and rapidly changing, These symptoms sometimes go alongside impulsive behaviors and a chronic sense of internal hollowness. Causes of borderline personality disorder. Research on the causes and risk factors for BPD is still in its early stages. However, scientists generally agree that genetic and environmental influences are likely to be involved. Imaging studies in people with BPD have shown abnormalities in brain structure and function, evidence that biology is a factor. Certain events during childhood may also play a role in the development of the disorder, such as those involving emotional, physical, and sexual abuse. Loss, neglect, and bullying may also contribute. The current theory is that some people are more likely to develop BPD due to their biology or genetics, and harmful childhood experiences can further increase the risk. Hypersensitivity to emotional stimuli causes an overstimulation in the emotional center of the brain, the limbic system or amygdala, and a much slower return to the normal emotional state or baseline. In addition, it is theorized that there is a reduction in the capacity of certain neurotransmitters to act as emotional brakes on the system, thereby holding a person in a prolonged state of the fight-flight response. Increased stress on the system through overstimulation and less emotional breaks manifests itself biologically by deficits in the prefrontal cortex of the brain. The prefrontal cortex of the brain is responsible for emotion regulation, inhibition of inappropriate actions, reality testing, error monitoring, and guides attention and thought. Therefore, as the prefrontal cortex of the brain is essentially turned off during periods of heightened stress responses, it is easier to understand the reactions of those who struggle with emotion dysregulation. It is important to note that anyone in a heightened emotional state will experience the exact same event as described. However, for the average person, it is usually short, and the volume is only a fraction of what it is for those who have emotion regulation disorder. Dialectical behavioral therapy, or DBT, was found to attenuate amygdala hyperactivity at baseline, which correlated with changes in a measure of emotion regulation and increased use of emotion regulation strategies. The study findings could suggest that dysfunctions in critical frontal control centers might be normalized after successful treatment. There is hope. Emotional dysregulation disorder does not have to be a prison sentence of high stress and regretful actions for persons with ERD or BPD and their families. With skillful vigilance to help keep emotional responses at a reasonable level and specific skills to help bring the volume down once it is increased, one can completely change their biological, social, and psychological reactions to stress. Life is worth living. The Gift Within the Storm, BPD and Perceptive Giftedness. Clinicians and psychology researchers have observed and proposed that many individuals have a special talent or gift, namely the potential to be unusually perceptive about the feelings of others. Increased sensitivity from an early age can usually be seen in those with ERD-BPD. This emotional sensitivity has upsides, as those with ERD-BPD can be very good at recognizing emotion in others, and are often good nurturers with careers in the helping field. When well, they are very in tune with their environments. And finally, keep learning the skills. You have the power to change your brain function. You can learn to regulate your emotions. Once well, you may find your gift that was hiding in the storm. Next week in our peer-guided DBT lessons emotion regulation module, we'll be examining how emotions help us.